Welcome back. Now, we've talked about the fact that my father's a retired dentist, my wife's a dental hygienist, and so I feel like I have just enough information for this next segment to be dangerous. I have heard them talk so often about receding gums and what a problem that is and what a hassle that can be for patients and doctors alike. But our next guests have really gone light years towards solving that problem in a very simple, straightforward fashion. Meet Dr. John Chow and Dr. Dave Richards this morning. Dr. Chow, why should folks be concerned about receding gums, first off? I mean, it sounds like something bad is happening, but I mean, how big a concern is it really?
Well, first of all, it's something that doesn't look good. And it could ruin a perfectly great smile if the gums are not lined up right. Of course, it's sensitive. Some people get a lot of sensitivity from gum recession. And of course, if it continues, it could jeopardize the tooth and end up with serious consequences, such as root canals and so on. So it's not something we want people to
You don't want it to go untreated.
Yes.
And yet the treatment in the past has been, it's been a little uncomfortable, hasn't it, in some cases?
It mainly involves removing a piece of gum from the roof of the mouth and grafting it to where the recession has happened.
Ooh, yeah.
And so the people who are concerned about this problem, the patients, they have a difficult decision to make to go through something like that.
Now you're teaching a technique though now to dentists all around the world are coming to you now for something called pinhole gum rejuvenation. And I asked you off camera, I said, am I understanding the process here? Is it really that simple? Explain it to folks, because in fact it is very simple. It avoids this whole idea of the skin grafting.
Yes, what it does, it takes away the need to cut and suture, cut or stitch, because the entire procedure then is done through a pinhole.
So this is how it used to be done, folks. Now you can picture exactly how uncomfortable that is.
Yeah, you take a piece from the palate or from the roof of the mouth, and you do have to lay a flap, open up the tissue, and place where you harvested from the roof of the mouth, and then suture it or stitch it to the gum over the recession. Now with the pinhole gum rejuvenation technique, we just use a pin to make a tiny little pinhole, and with specialized instruments that I invented, we can relieve the tissue from the supporting structures underneath, loosen it up, so to speak, and then basically slide it down to where it belongs. Now once it's loosened up and sitting where it belongs, then through the little pinhole, then we put strips of collagen that can go under the gum, and that will stabilize the gum where it belongs, and then without having to suture it. So throughout this entire procedure, there's no cutting at all, and then there's no stitching, so it looks great after it's done.
So you walk right out of the office, it looks great, and you've got basically no downtime, it doesn't look like.
No, there's no downtime at all to speak of, and there's hardly any discomfort. Patients take about 1 or 2 pain pills, and one dentist who took the course said this is a huggable procedure. He never used to get hugs. Now he does this, he gets hugs all the time.
Well, let's find out from Dr. Richards then. You decided to start offering this procedure. You're a periodontist here in San Diego.
Correct.
You decided to start offering this procedure. Why?
Well, when I first went to investigate what it was all about and visited Dr. Chow's course, I just wanted to learn what he was doing. I thought maybe it could influence my practice or help my practice. After training with him, I immediately came back to San Diego and implemented this procedure for the big reason that it is less painful. Post-operative morbidity here is significantly decreased to what we used to do.
About how many folks have you performed the procedure on then now?
Almost 50. I've been doing
50?
it.
Really?
Yes.
Wow.
I took the course last summer and have pretty much implemented it largely for root exposure coverage.
Now we saw some before and after shots there that were pretty amazing, and some of the results that we could get. Dr. Chow, again, you are training doctors from all over the world. They're coming to you for this procedure. About how many do you think you've trained so far on this?
We trained about 850 doctors from all over the world, Mongolia, Korea, mostly from North America, US and Canada. And so they're out there, you know, even in San Diego. We
Well,
have a number of dentists. Who
Dr.
are
Richards is
operating.
certainly here in San Diego,
Dr.
and
Richards is an excellent periodontist who's offering this to people in San Diego.
well, thank you so much for coming in and sharing that this morning. And you know, folks, if you're dealing with receding gums, somebody you know, somebody you love, or file this away in the back of your mind and you know, ask your dentist about it the next time. And you know, someday, what is that percentage of folks that deal with receding gums at some point in their life? Is it a large number of people?
If you live to be about 85, the chances are about 90%.
Oh, wow.
You'll get receding gums. Now, even kids who are younger getting orthodontics done, they sometimes get receding gums afterwards. So it cuts across the board.
This works for young and old as well.
Young and old. It could be from
Fantastic.
12 to 80.
Well, I want to remind everybody what the website is then. It's pinholegumrejuvenation.com, just like it sounds, pinholegumrejuvenation.com. Or you can call the number here that's on your screen. That's 888-603-2953. Got that up on the screen. To find a dentist in your area, and certainly you can get in touch directly with Dr. Richards, I'm sure, as well. Thank you so much for coming in and sharing that this morning.
Thank you for having us.
See, now I can go home and tell my wife I know something new that she hasn't learned in her practice yet.
Well,
Very good.
Tell her hello for us.
And then I'll be in the doghouse for doing that. But thanks for coming in, doctors.
Thank you.
Very
Thank you.
much. All right, for more information, go to san diego6.com and click on San Diego Living.